I'm Dr. Mark Valente. I'm an orthopedic spinal surgeon in the Dallas-Fort Worth area, and I specialize in minimally invasive surgeries for the spine. I'm the founder of the Disc Spine Institute. We have multiple locations across the Metroplex. I do complex reconstruction spinal surgery, but I focus more on minimally invasive procedures for the spine. I also do revision surgery for people who have had back procedures and who have recurrent pain or persistent pain. But my focus is really on trying to get people better without surgery, and the best way to do that typically is with physical therapy, chiropractic care, acupuncture, injections, which could be anything from an epidural steroid injection to what we call a facet injection, spinal cord stimulator trials, pain medications, anti-inflammatories. We really have quite a number of different conservative treatment options to try to get people better first. And then if they fail all of those things, then sometimes we consider the surgical options. I grew up in a suburb outside of Detroit in Michigan. After high school, I went to the University of Michigan and majored in biology, and then went to medical school in Florida. After that, I went back to Michigan to do my orthopedic surgery training, and that's when I really got interested in spinal surgery. I had a really good mentor who was doing a lot of minimally invasive spinal surgery work, and he helped really cultivate, I think, and pique my interest and fascination in trying to diagnose where people's pain was coming from. That's really the difficulty with spinal surgery, and it's really truly an art, in my opinion, to try to find where the pain generator is coming from. So after my experience there in Michigan, I then went to the University of California at San Diego and did spinal surgery fellowship. And then after that, I moved to Dallas to join a specialized group of spine surgeons who focus on minimally invasive surgery. If you don't pay attention to what the patient is telling you, you'll miss the diagnosis. So people on their MRIs can have degenerative discs at multiple levels and a pinched nerve at different levels and arthritis in their facet joints at many different levels. But the way we actually pinpoint and figure out what the actual problem is that's causing somebody's symptoms is by listening to them. So you have to have good ears, and you have to put that with the imaging to really come up with what the problem is. But if you put their history with their imaging together with their physical exam, you can pinpoint the problem, and therefore you can do a very small, minimally invasive procedure to get rid of their problems without disrupting the other tissues up and down their back. Pain really, I think, is the #1 driver while people come and see me. And when you have pain, your quality of life really goes down. And so some people can't work, or they can't enjoy their life. They can't play tennis or golf or play with their kids or grandkids. And when that happens, people need help and they need answers. And so that's when they come to me. I believe standards in medicine are critically important. They help to give us sort of a barometer. They help to keep physicians and patients and practitioners all within a range of care that's appropriate. It's a standard of care is what we call it in medicine. And we, as physicians, need to make sure that we hold ourselves to at least the standard of care in a given community. And luckily for us in Dallas-Fort Worth, the standard of care in this community is exceptionally high. We have some of the best providers, best physicians, and best hospitals in this country. And I'm proud to say that my training and the facilities I operate at are top-notch. Being listed on Top10MD is really a great thing. I think that it reinforces for myself and for my patients that we are really reaching a greater audience, and we're being acknowledged for the work that we're doing, helping people. And I think it's important for the community to see that, and to also give the community a little insight into who the physicians are in the community that are offering the highest level of care.